we shall be discussing HIV. So, HIV, by definition, is a viral infection that attacks the body's immune system, specifically the CD4 cells. If left untreated, it can follow to acquired immunodeficiency syndrome, a condition where the immune system is affected and severely weakened, where it is making difficult for it to fight off the infections and diseases. Also, there are two species of lentivirus, a subgroup of retrovirus that infects humans. Over time, they cause acquired immunodeficiency syndrome, a condition with progressive failure, as discussed. Without treatment, the average survival time after infection with HIV is estimated to be 9 to 11 years, depending on the HIV subtype. Also, in most cases, it is a sexually transmitted infection and occurs by contact with or transfer of blood, pre-ejaculate semen, or vaginal fluids. Non-sexual transmission can occur from an infected mother to her infant during pregnancy, during childbirth, or by exposure to her blood or vaginal fluid and through breast milk. Within these body fluids, HIV is present as both free virus particles and virus within infected immune cells. And also, there are certain researches which has shown that HIV is not contagious during sexual intercourse without a condom if the HIV positive partner has a consistently undetectable viral load. It infects also the vital cells in the human immune system, such as the helper T cells, specifically CD4 plus, macrophages, and dendritic cells. The infection can lead to low levels of CD4 plus T cells through a number of mechanisms, including pyroptosis of abortively infected T cells or apoptosis of uninfected bystander cells, direct viral killing of infected cells, and maybe in killing of infected CD4 plus T cells by CD8 plus cytotoxic lymphocytes that recognize infected cells. And when CD4 plus T cells numbers decline below a critical level, so cell mediated immunity is lost and the body becomes progressively more susceptible to opportunistic infections, leading to the development of AIDS. So this is the HIV life cycle, which is an important benchmark to understand how this thing is circulating and what are the various important elements involved. So first element is the binding and the fusion. If you can see in this particular image where the HIV is binding and attaching itself to receptors on the surface of the CD4 plus cell. So here the HIV binds with the CD4 cell, a type of immune cell using proteins on its surface, which is GP120 and GP41, that attach to receptors CD4 and CCR5 or CXCR4 on the cell surface. The virus then fuses with the cell membrane, allowing the viral contents to enter the cell. Second, we have reverse transcriptation, where inside the cell, the HIV releases its genetic material. So, once the binding is done, which is also called attachments, thereafter there is a fusion, then there is reverse transcriptase, where inside the cell, the HIV releases its genetic material, RNA, and enzymes, including reverse transcriptase. So, reverse transcriptase converts the viral RNAs into DNA, a process that is prone to errors leading to mutations. And there is a process in this where we have integration. The newly formed viral DNA enters the host cell's nucleus, where it is integrated into the host's own DNA with the help of the enzyme integrase. So the integration makes HIV a permanent part of the host cell genetic material. And as far as the replication part is concerned, so once integrated, the host cell's machinery is used to produce more HIV RNAs and proteins. These proteins are the building blocks of new HIV particles. And there is an assembly step where the newly produced HIV RNA and proteins move to the cell surface and assemble into immature non-infectious HIV particles. There is a very important last step, which is budding, where the immature HIV particles then bud off from the host cells, releasing new HIV particles into the bloodstream. The protease enzyme, then another HIV enzyme that cleaves the newly synthesized polyproteins to create mature infectious HIV particles. So, as a summary, the HIV, it is using the host cell's machinery to replicate, creating more copies of itself, which then infect other cells, eventually leading to a weakened immune system and or without treatment, which can lead to AIDS. And these seven steps should be, memorized as a part as to how the HIV is regulating and converting itself into the AIDS factor. Also, the key points, as I mentioned, where HIV attacks and destroys the CD4 cell. The second part is where HIV is using the machinery of the CD4 cells, and as a therapy, we can use antiretroviral therapy, which is use of combination of HIV medicines to treat HIV infection. So, this cycle becomes again important because of how we are going to tackle it. So antiretroviral therapy is one of the options where people on ART they take a combination of HIV medicines from at least two different HIV drug classes every day because each class of drugs is designed to target a specific step in the HIV life cycle and is very effective in preventing HIV from multiplying. So, just to recapitulate, CD4 cell count and viral load, which is a very important benchmark, like the acute infection will have flu-like symptoms. The HIV high, there will be high viral load. CD4 cell count will drop temporarily, and thereafter the clinical latency, where it is asymptomatic, the viral load stabilizes, and CD4 cell the count declines slowly and count below 200 the high it leads to high viral load. Also there can be opportunistic infections and as far as in the cycle also I mentioned once HIV enters the body it targets and infects a certain type of white blood cells called the CD4 cell. Then HIV then takes over or hijacks these cells and turns them into factories that produce thousands of copies of the virus. So each time HIV uses the cell to make more of itself it destroys the CD4 cell. So coming on the transmission part, so HIV is transmitted primarily through unprotected sex. So vaginal, anal or oral sex with an infected person without using a condom or other protective measures. Blood transfusion receiving contaminated blood or blood products from an infected person. Sharing needles or syringes contaminated with infected blood. Mother to child transmission where an infected mother can pass HIV to her child during pregnancy, childbirth or breastfeeding. Occupational exposure, the healthcare workers can be exposed to HIV through needle sticks or other sharp objects contaminated with infected blood. So, coming on the symptoms of HIV can vary depending on the stage of the infection. Acute HIV infection, there are flu-like symptoms such as fever, headache, and fatigue, which can occur within 2 to 4 weeks after the infection. Chronic HIV infection stage, as the virus progresses, the symptoms can include weight loss, fatigue, swollen lymph nodes, skin rashes, oral thrush, or fungal infection. In AIDS, there are severe symptoms which can occur when the immune system is severely weakened, including pneumonia, tuberculosis, toxoplasmosis, which is a parasitic infection, and Kaposi sarcoma, which is a type of cancer. So usually, when patients are coming in the OPDs, they might experience pain in the areas like the abdomen. There are pain circumstances which can occur while swallowing. Cough can be dry. Whole body will experience a fatigue state, a fever state. There can be loss of appetite. There can be malaise. There can be night sweats or sweating. Or maybe there can be gastrointestinal symptoms like nausea, persistent diarrhea, vomiting, or watery diarrhea. In the mouth, you can observe ulcers or white tongue or maybe in the groin area you can observe sores or swelling. Throat, the patient will complain about the difficult swelling or swallowing or soreness. Also, commonly you will see there opportunistic infection or maybe there is headache, there's oral thrush, pneumonia, or the red blotches can be one of the options. There are severe unintentional weight loss history. There is skin rash, or maybe there is swollen lymph nodes. So these are the things which could be one of the noted points. And three very common things which should always be remembered is fever, fatigue, and swollen lymph nodes. There are other possible symptoms also. There can be muscle ache, night sweats, as I mentioned, and some individuals can experience no symptoms at all during the early stages of HIV infection, and making it a regular testing more crucial at some points. So, as far as the diagnosis part is concerned, blood tests which can detect the presence of HIV antibodies or antigens. They are rapid tests which are quick tests that provide results within 15 to 30 minutes, and viral load tests to measure the amount of HIV in the blood. So basically, as far as the blood or saliva tests are concerned, with rapid testing, it can provide results within minutes, and lab tests offers more comprehensive analysis. These tests detect HIV antibodies, antigens, or viral RNAs, with antigen antibody tests being the most common and able to detect HIV as early as 18 to 45 days after exposure. So, antibody tests, it will detect antibodies produced by the body in response to the HIV infection. In antigen test, we can detect both HIV antibodies and antigens, the proteins of the virus in the blood. And NAT tests where we can detect HIV RNAs or DNAs in the blood, allowing for earlier detection than antibody tests. Rapid tests, which can provide results maybe within minutes, often used for point of care testing. This is a very important thing. Also, we can go for lab tests where we require sending a sample to a laboratory for analysis, offering more comprehensive results. Option for home sampling kits where the individuals can collect sample at home and send to a lab for testing. And the working is usually in the antibody test, we have to look for antibodies against HIV in blood, urine, or saliva samples. And in the antigen, we can detect both HIV antibodies and antigens. And in the NATs, we can detect the presence of HIV's genetic material, which is the RNA or DNA. So everyone between the ages of 13 and 64 should be tested for HIV for at least once. And people with certain risk factors should get tested more often. Early testing is crucial for assessing treatment and preventing transmission. And usually, people in any kind of setup, they go for health clinics or hospitals or testing centers, or maybe there are free HIV testing websites where people can approach. Coming on the treatment part, so antiretroviral therapy is the primary treatment for HIV, and the medication, it usually includes a combination of medicine that suppresses the virus, slowing down its progression. There's adherence, so strict adherence to the treatment regime is crucial to achieve viral suppression, and regular monitoring, where regular blood tests to monitor viral load, CD4 cell count, and other health test indicators. So the basics, as I mentioned about the antiretroviral therapy, while ART cannot cure HIV, but prompt HIV treatment can help all people with HIV live long, healthy lives and reduce the risk of HIV transmission. So, one of the primary goals of HIV treatments is to reduce a person's viral load to an undetectable level while nearly eliminating the risk of transmitting HIV through sexual contact. So, basically, this is on a regular schedule. Usually, every day or once a month or every 2 months, injections are there. And also, ART is recommended for everyone who has HIV. And the medicines, it can directly attack and destroy the infection fighting CD4 T lymphocytes of the immune system. So loss of CD4 cells makes it hard for the body to fight off infections, including opportunistic infections. So HIV medications, they prevent this HIV from multiplying, so which reduces the amount of HIV in the body. Having less HIV in the body gives the immune system a chance to recover and produce more. And by reducing the amount of HIV, medicines can also reduce the risk of HIV transmission. So this is a very important. These two things are important. So we are controlling HIV, also we are reducing the viral load. So, prevention strategies, safe sex practices using condoms, dental dams, and other protective measures during sex. Pre-exposure prophylaxis, which includes taking an ART medication before exposure to HIV. Post-exposure, taking ART after exposure to HIV to prevent infection. Needle exchange program, where providing access to clean needles and syringes, and which is further reducing the risk of transmission. HIV testing, regular testing to identify and treat HIV infections earlier, and stages of HIV infection, CD4 cell count, and viral load. So, antiretroviral therapy and other treatment options should be the mainstay. So, focus on consistent condom use during sexual activity, avoiding sharing needles, and considering pre-profile exposure prophylaxis or post-profile exposure prophylaxis is important if at risk, along with regular HIV and STIs testing. So these are the basic things as far as the basic prevention strategies are concerned. Other prevention measures can be voluntary medical male circumcision, where in high burden countries this can reduce the risk of HIV infection in men. Also, knowing the HIV status, getting tested is one of the important things. Advocacy for HIV prevention is another thing, where through self-help groups or through awareness programs, things could be promoted, where HIV prevention messages and reducing the stigma and discrimination which is associated with it, to create a supportive environment for HIV testing and treatment. That is a very important point. Coming on the next important disease, which is syphilis. So basically, syphilis is an infection which is